Well, I told you at the beginning you were going to learn a lot. And we learned a lot. And do we have the answers to every question? No. In fact, I can prove that because there's this many cards. Now, I'll also tell you, we're not going to get to every question. And my staff has already tried to sort through some and put the duplicates together. As we suspected, many of you have the same questions. Also, quite a few of you had questions that were fairly individual and personal, and so we're going to tell you we're not taking those questions. That's what the navigators are for. And so the navigators are going to be able to help you with the very individual and unique questions because we're all different. And as we just learned, if we're businesses, we might have fabulous opportunities available to us to help our employees, and we might not have been thinking about this at all up until now. I confess, guilty, I should know this, I didn't know about the tax credits for businesses and how much it could mean. And I have a huge number of small businesses in my district. In fact, everybody has huge numbers of small businesses in their districts, and I knew that this was a win for them, but I didn't realize this part, so thank you. So again, I apologize in advance because many of you are not going to get your questions heard. I want to again remind people, or people who weren't here in the beginning, there are actually representatives from a number of the navigators who are here in the back and outside, and they can help you sign up for an appointment to follow up with them if you like tonight. We will be getting everyone who we have an email or an address for the master list of navigators in Manhattan. We didn't quite get that done.
Not enough.
Not enough. So if you didn't get that, hopefully you let somebody at the front table know. We will get you that material. And again, just as we roll into the questions, whichever of you three who think you have the best answer for that specific question, I'm not trying to put you on the spot, but I bet all of you will be able to figure this out. So, can somebody explain what the penalties will be if you don't sign up for insurance?
I'll start. No. Okay. Can you hear me? No. I can talk. Oh, yes, it is. I was just going to talk very loudly. So, people who don't sign up for health insurance in 2014 may be liable to pay a penalty. There are exemptions for a variety of people who don't file tax returns, taxes at the end of the year, people who for financial reasons could not possibly afford to pay for health insurance, Native Americans. There are a variety of reasons. But for those who may have to pay penalties, in 2014, the penalty would be either $95 or 1% of your annual income, whichever is greater. And I think that, while we hear stories about people who say, well, either $95 or even 1% of my income is so little money, why wouldn't I just simply pay the penalty and not get health insurance? And I think the answer here is it's really important to explore what your options are, because you may be eligible for Medicaid. Since Medicaid has expanded, New York has expanded Medicaid to 138% of the federal poverty level, and single adults are eligible for Medicaid, which was not the case up until now. And so they may be eligible for Medicaid or public insurance. Or they may be eligible to have a qualified health plan, a private plan, with significant subsidies depending upon what their income is. And overall, to get this, what I call in the strategic message, is peace of mind. So that while literally paying that $95 will be cheaper than any plan, except for public insurance, except for getting on Medicaid, you know, it may not be cheaper in the long run. And so that's basically the answer about penalties.
Thank you. Okay, so are the navigators free of charge? The answer is yes. I don't need to ask them. And again, they've been hired by the state of New York to provide the best information available. So they're not working for any specific plan. And in fact, a warning has already come out, just for people to know, that if somebody approaches you and they say that they have their own system to help you sign up, and you don't need the state system, please understand that they might be a scammer who's just trying to get your personal data, or they might be somebody trying to sign you up for a plan that actually may not be the right plan for you because they're not part of the exchange. So please use the navigators, the state's website, the official state of New York materials, because we are concerned that, you know, anytime you start a new program, there's somebody out there who wants to try to scam you. So just the same smart, cynical rules all of us New Yorkers have gotten very good at. You know, if your instinct tells you it's too good to be true, it probably is. And if somebody's calling you up out of the blue to say, have I got a deal for you? The state's not calling up and soliciting you. Okay, so be smart and careful. Does the website tell you where navigators are located? Yes, do, and we're going to make sure you have all the Manhattan sites. But yes.
Yes, so you can go to the website and search by what county you live in, and there'll be a long list of navigators. You can call the toll-free number, and they'll set you up with the nearest navigator. Navigators aren't allowed to do cold calls, so you won't get a cold call. If you get a cold call, it means it's not a navigator, no matter what they say. It's free, and navigators have to be unbiased, and we're all certified. We go through the 3-day training and pass a bunch of tests and get certified to be navigators.
Thank you. We've been talking a lot about the web system. Can you get just an old-fashioned paper application applied that way?
You can. It's not the method of choice, but you can enroll through a hard copy application, and those will be available on our website. I don't think they're on it right now. The preference is that people who don't want to do this themselves really go to a navigator or call a call center, because then there can be this interaction so that your questions can be answered, and it's just a more effective and efficient way of exploring the enrollment process. But literally, yes, there is a paper application that can be used.
Thank you. Are there any fee-for-service plans, or are they all managed care HMO type insurance plans?
There are a variety. You want to answer that? I don't know.
There are a variety of different plans. Some are EPOs. There are all different kinds of plans on the website.
Another reason you need to talk to a navigator about your situation. Okay. So this is a little long, but I get it completely. And it's for you as a small business question. As a small business owner who currently provides health insurance to my employees, and it happens to be with Oxford Healthcare, I've received notice that my current plan will be replaced effective January 1st, 2014. My question is whether this is mandatory change for all small businesses, or only because I have health insurance with somebody who has signed up to be a plan with the exchange, and will my premiums be the same or different?
Okay, so there are a number of reasons why a plan may be canceled, whether it's an individual's plan or a small business, plan. The most likely is the fact that the plan does not conform to the it's not in compliance with the law, meaning it doesn't provide coverage of the 10 essential benefits. And you would be surprised how many plans don't cover all of them. So the odds are that's why that's happening. Whether or not they're going to offer the business the same kind of plan at the same rate or not is, I'm not sure. They might not. But what I would say to the employer is you should check out what they're going to offer you, and you should also go into the marketplace and review what may be available to there for you as well. And most importantly, figure out whether or not you might qualify for those tax credits, because if you do, you're probably not going to want to shop outside of the marketplace and forfeit them.
And I want to add to what Marcia said and what she described so well during her presentation, and that's this idea of choice. So small employers really have a major opportunity to provide a really broad swath of choice for their employees. And so while this employer may have only provided Oxford because a small employer would not be looking to provide several different plans, it's an opportunity for this employer to take a look at what the plans are out there, what the needs of their employees are, and to better meet those needs by exploring enrolling through the marketplace with one or more plan options available to their employees.
Thank you. I think you did say this before, but how can I find out which hospital systems participate in which plans? That is something that the navigators will be able to let you know, right?
Yes, and also if you go to the plan's website, they'll have the network of providers in all their networks.
Will the number of doctors who accept insurance be as robust under the American Care Act as they currently are? This person doesn't live in my district because one of the #1 complaints we get in my office is how few doctors actually take insurance now, and they tell you, well, you pay me, and then you get it back from your insurance, and that is such a huge issue. So I don't mean to really chuckle, but it's like, really, it can actually get worse based on the experience we've been having, and we have huge numbers of doctors in my district. So do we think it will be more or less robust as far as the number of doctors available?
I can't speak to that specifically. What I can say is that one of the requirements to qualify to be a health plan in the marketplace was the health plans had to show that they had adequate networks of providers and hospitals. And so that was kind of the linchpin. And what is an adequate network was a determination that was made by the Department of Financial Services, who generally oversee the health plans in New York State. And so it's our hope that there will be health plans that have significant provider networks, and that the providers will want to be a part of those networks, because there will be so many more people who will be insured. So,
thank you. I knew I was going to get this question. Do people on Medicare just continue as usual? Does anything change for you if you're on Medicare?
Nothing changes. You continue as usual. You continue to have your Medicare and whatever supplemental policies. The marketplace is not for you.
Do we think more health plans are going to be added to the marketplace, or is what you see now what you get?
As far as I know, for the next year, 2014, those are the health plans that will be in the marketplace. I don't know what will happen subsequently.
In terms of calculating how much I need to pay for my health plan, will only my salary be considered, or my other assets as well? Will I need to submit verification of income?
So your income, when you do your taxes every year, the income that you list on your income taxes is the income that gets counted. So we have a long list of what is income and what isn't income. A navigator could help you figure out if a certain source of income counts or not. The second part, oh, do you have to submit documents? Most likely not. Most likely you will just enter what you expect your income to be. If it varies from what the marketplace is expecting, you can explain with sort of a drop down, here's why my income has changed. You might have to provide a little more information, but hopefully you won't have to submit any documentation.
Do we know if any of the plans on the marketplace offer out-of-network options or out-of-state options?
Marcia?
I believe that there are plans on the marketplace that do offer out-of-network. I think they're the platinum and the silver. I forget which levels they are, forgive me. But I'm pretty sure there are also providers that offer multi-state options in terms of provider coverage.
Yes, I think that there are a few multi-state insurers in the marketplace.
In terms of mental health treatment by psychologists and psychiatrists, they've really not been very well reimbursed, or insurance hasn't covered that much for those services. Is there going to be any change in that reality under the marketplace plans? And will they be putting, quote, unrealistic ceilings on how much treatment you can get?
I'll just say one thing first. I don't know about the reimbursement rate, but I can tell you that mental health and substance abuse are now one of the essential health benefits, those 10 essential health benefits that must be included in the most basic plan. And so that's a real movement forward in coverage for healthcare issues.
Yes, I was going to say, New York State and the Affordable Care Act have mental health parity provisions. So now you'll be paying the same kind of co-pays and cost sharing. It'll be similar to what you'd be paying for another kind of medical service, and those services are covered with the same kinds of limits as other kinds of visits.
And that was a parity provision that was really important in the healthcare community.
I think it is very important because New York State liked to pretend that we passed a law to provide mental health parity, but it really only was applicable to like 50% of insurance coverage in the state of New York. And now, because of the federal plan, again, it's defined as essential service, and all these insurance plans are going to have to cover. So the bad news is probably it still won't be a reasonable reimbursement rate based on the costs. The good news is a huge number of people who had health insurance that really didn't cover almost anything in mental health. All of the options will have to include mental health care services.
But one thing I do know is the networks do have to include mental health and substance abuse providers. That was part of the requirements for what's an adequate network. So hopefully that will increase a little bit the availability of providers.
RE teaching hospitals. Bellevue is a teaching hospital. I actually have a lot of teaching hospitals here on the east side in Bedpan, Alleyland. It's a teaching hospital, but Bellevue is a teaching hospital where you can apply for a clinic card and pay the lowest cost rates for health services. Does it count as an official insurance plan under the marketplace law? If you're already going to someplace with the clinic cards and you're very happy with services, what happens?
I think they might be talking about HHC options maybe, which is actually hospital financial assistance. Is that so that's not insurance. That you get discounted rates when you go to HHC hospitals, but it's not insurance, and if you have an insurance policy, you might very well qualify for Medicaid for free or for great discounts on getting commercial insurance, which would open up your options and would also mean that HHC hospitals get more funding through your insurance plan, so that's good for the hospitals as well.
Are the premiums deductible against your 1099 tax form income the same way as current insurance programs with private insurers are deductible?
So I know on the shop side that you still, so if you're a small business and you're claiming that credit for 50%, the other 50% you can still claim as a deduction. So the deductions don't go away.
Yeah, but no, for individuals.
Oh, for individuals who now deduct the cost of insurance premiums, that's an allowable deduction on the federal tax.
Or they give you, there's a credit that they give you for your...
Or they give you a credit for it. So do
I'm
we
not
know
sure.
if the federal...
I'll have to look into that.
We don't know. We will get back to you. Okay. Although it's a great question to ask a navigator when you're reviewing, but my office will also look into that question, whether anything changed in the federal tax policies on this. Okay, if you're an individual, not the business side of it. Most New Yorkers are convinced, one second. Oh, most New Yorkers are convinced this is a good idea. Tell me if this information is applicable to other states. I have a brother living in a different state who needs convincing. I guess because there is so much mythology out there, particularly over the last couple of weeks where apparently we've brought the government to a halt and potentially the world markets to a halt over the disasters that will happen if we continue forward, even though most of us here in New York actually get this is a win-win for everybody, so what's everyone so hysterical about? But it's not the same exact system in every state. And I have no idea about Georgia. Any of you know?
I don't know specifically about Georgia. I'm trying to remember what the states look like. But I will say a couple of things. First, that every state has to have a marketplace. Some states, like New York, set up their own marketplace, which makes total sense because we understand more about what New Yorkers need and how they function. And so we were able to set up a marketplace that really, was that New Yorkers could relate to and that responded to needs. Those states that did not set up their own marketplace, in those states, the federal government has set up the marketplace for them. Now, obviously, that's of concern. And if you've read the newspapers, you see the articles that say where the federal government has set up the marketplace, frequently they're getting tremendous pushback from the state officials. So the state officials are not allowing navigators to be in health centers, a whole variety of ways that set up barriers to having people enroll, not allowing ads to go up, a whole range of things. So the marketplaces are going to be very, very different. And then, the other piece is that the federal government has determined that in some of the federal exchanges, they're going to delay something. So for example, a question had come up in one of our previous presentations that Carrie and I were at, where the shop exchange in the federal marketplaces was not going to begin enrollment until November. But in New York, that's not the case. We've got our exchange. We're working with our rules. And so many of the exchanges, many of the states have not expanded Medicaid. And so that's going to mean that there are going to be a sizable percentage of the population who would otherwise be eligible for Medicaid based on the expanded federal poverty level and based on the fact that they're single adults, no dependents, who will not be able to access health care. So there are real differences. But if somebody really wants to find out about a particular state, I'll certainly find out for you.
And we've
There's somebody else.
I was going to say there's a great map on the Kaiser Family Foundation Health Reform site that defines every state and whether they're doing their own state-based marketplace like we are here in New York, or whether they're participating in the federal marketplace. So you can easily go up there and figure out state by state where it stands.
Oh, great.
And I've just been reminded to look at my watch, which is almost 8 o'clock. So I'm now going to do the rapid response question. So if somebody can answer a question quickly, and then we'll try to get through a few more of these. And also just to remind people, if they wouldn't mind filling out the evaluation for the Manhattan Chamber of Commerce.
By the way, I just want to say that's not a state survey.
Oh, okay. It's the Manhattan Chamber of Commerce survey, not the state survey. What happens if you want to change your plan during the year? Can you? Or is it a year that you sign up for? What's the story?
So most people, we have this open enrollment period between October 1st and March 31st, and if you're an individual and you need to get coverage, you need to sign up during that time. There will be special enrollment periods. So if something in your circumstances change, if you have a divorce, if you have a birth, a death, you lose a job, your income changes, there are a number of things that might change your circumstances. And so if that happens, then you have a short period when you can go back to the exchange and either get a plan or change your plan.
But basically, I want to add that once you sign up for a plan, it's a yearly contract. So barring those particular circumstances, you've got a year plan.
And if you enroll after December 15th, when does coverage start?
If you roll December 15th through December 31st, then you would start February 1st. So if you enroll in the first half of the month, then it starts the first day of the month after that. If you enroll in the second half of the month, then you wait until the month after that.
Thank you. So many good questions I'm not going to get to. Is there a cap on the amount of income a person can have in order to participate? I mean, we know there's a cap on whether you could be eligible for credits back from the federal government. But is there any cap where if Mike Bloomberg shows up for the market exchange?
We'll take his money.
He'll pay full price.
He'll pay full price. Okay, Mike, just letting you know I'm watching out for you. Because he'll lose his government insurance. That's right. Just for the record. Okay. If you pick a plan, can you then change if you find, oh, it's sort of the same question. You know, you sign up for a year unless something else has changed, which is why you really want to use a navigator and try to make sure that you are getting the best match plan for you. Because again, every one of us is different. If your doctors participate in a certain hospital and you know you really want to work with them and that hospital, you probably want to sign up for a plan that covers that hospital. If you have special health care needs and you know you need specialists for XYZ, you probably want to sign up with a plan with doctors who specialize in those needs. We're all unique individuals. Somebody talked about MIGI. What does it mean?
It's MAGI. It's modified adjusted gross income, technically, and it includes a number of different things. And I would highly recommend you speak to your accountant to get a real numbers definition of what's in it and what's not.
What if I drop my present insurance, buy insurance on the state marketplace, and Obamacare is repealed? Will I then not have the insurance? Okay, the only time we're going to repeal Obamacare is if you have, not to be partisan, a Republican House, Senate, and President. Just for the record, that's the only way it can happen. So not anytime soon, but watch for that, but you don't have to worry about with a one-year enrollment. Okay, let's see. You know what? I think I actually have to thank our guests so much for their thank all of you for coming and staying. Remember, you can talk to a navigator in the back. You can find a date and time to have a personal appointment to go over things. And really thank you so much, all three of you, and to the Lighthouse for letting us use this.